Good morning. Thank you for attending this morning. I am Dr. Shannon Salvador, and I am the president of the Society of Gynecologic Oncology of Canada, also called GOC. I am joined by invested members of our healthcare communities, public sectors, and patient advocates. This panel consists of Dr. Sarah Kean, a gynecologic oncologist working in Manitoba, Carmen Wyton, president and chair of Women's Health Coalition of Canada, Dr. Leslie Roberts, the Advocacy Director of the Society of Gynecologic Oncology of Canada, Dr. Carla Willows, President of the Society of Canadian Colposcopists, and Dr. Annie Lung, the lead Communities of Practice in the Human Papillomavirus. We are here today because Canada is currently facing a silent national health crisis. While many celebrate the advancements in modern medicine, there is an alarming outlier. Cervical cancer is now the fastest rising cancer in Canada. As a physician who treats these patients every day, I can tell you that this statistic is not just a medical failure. It is a policy failure. This is a disease that is almost 100% preventable. In 2025, an estimated 1,650 Canadians will be diagnosed with cervical cancer, and 430 will lose their lives. Each of those deaths was avoidable. So why are we losing ground? For decades, we have relied on Pap testing, and our initial enthusiasm for the HPV vaccination upon its first debut in the mid-2000s in Canada. But Canada has now evolved, science has now evolved, and our policies have not kept pace. We are currently facing some major setbacks. There is a vaccination gap, as our national HPV vaccination completion rate has stalled at 64%. This is far below the 90% target that is needed for elimination. We currently operate on a postal code lottery system for healthcare, and whether you receive the most sensitive screening technology, the HPV DNA test, currently depends on which province you live in and even where you are in some provinces. For years, there has been a health gender gap as too many women, particularly those in rural, Indigenous, and underserved communities, are falling through the cracks of a fragmented system. Today, the GOC is presenting our white paper. It's an evidence-based anchor for change written and endorsed by 21 national and provincial organizations. We are calling for an immediate national shift to HPV DNA testing for cervical cancer screening, and implementation of HPV self-collection swabs and kits. These are at-home swabs that remove the barriers of travel, history of trauma, or cultural marginalization, and the lack of a family doctor. There is a legislative solution through Bill S-243, the National Framework for Women's Health in Canada Act, and why our presence here today is so critical. Our white paper is the clinical how, but Senator Danielle Henkel's Bill S-243 is the legislative vehicle. By establishing a national framework for women's health, this bill will standardize care, ensuring that life-saving HPV testing with the option for self-collection is a national standard, not a regional privilege. It will help drive prosperity by closing the women's health gap, which is not just a moral imperative, it's an economic one, with the potential to boost Canada's economy by $37 billion annually by 2040. If you look just at the cost of treating cervical cancer alone, in 2024, this disease cost the Canadian healthcare system about $132 million. To fully screen the entire Canadian population that are eligible, this would cost about $106 million over a 5-year period with this new DNA test. It is an incredible economic savings to our country to invest in preventative care. Prevention is the most effective cancer treatment we have. Bill S-243 prioritizes prevention. So let's move forward with women's health from an afterthought to a permanent funded core Canadian value. This is our collective voice. Together, we are sending a clear message to our elected officials. Women should not be presenting with advanced preventable diseases in today's healthcare system. We have the tools to make cervical cancer the first cancer ever eliminated in Canada. We have the medical expertise. We just need the political will to pass Bill S-243 and turn this framework into a reality for every person in this country. Thank you. I will now turn the floor over to Dr. Sarah Kean.
Thank you. My name is Dr. Sarah Kean, and I'm a gynecologist working in Winnipeg, Manitoba. I have the privilege of working on Treaty 1 lands and working with its people. Shannon, I have to echo your words here about failure, but I am here to talk about who we are failing. We are failing our sisters and our mothers and our daughters. Cervical cancer is a devastating disease with far greater societal burden than any other cancer that I treat. All the more devastating because this is entirely preventable. Manitoba data shows that 30 and 40-year-olds have the fastest rising rates of cervical cancer. This is impacting women in the workforce, women who are raising families, and women who are acting as pillars of their community. And so I come before you today not only as a Winnipeg constituent, but as somebody deeply concerned about an urgent and preventable public health issue. I come with a solution, which is the need for robust, accessible HPV screening across Canada and federal legislation to support it. Cervical cancer is one of the most preventable cancers. We understand its cause. It's a virus called HPV. We have tools to eradicate it completely. We have tests to detect it early. We even have vaccines that can prevent the majority of cases. In 2020, the World Health Organization made a declaration to eliminate cervical cancer worldwide, and yet in 2025, we have a Canadian Cancer Society report which is showing increasing rates. All other cancers in our country are decreasing in incidence, except for the one that is entirely preventable. In Canada, which is one of the wealthiest countries in the world, women are still being diagnosed too late, suffering unnecessarily, and dying from something that we have the power to stop. Canada has already committed to eliminating cervical cancer alongside the World Health Organization, and that strategy relies on 3 pillars, which are vaccination, HPV-based DNA screening, and access to treatment. More than any other cancer, cervical cancer reflects striking global health inequity. This was written by Agosti and Goldie in 2007 in the New England Journal of Medicine, and it holds true today, and it holds true within our borders. In Manitoba, cervical cancer disproportionately affects First Nations, Métis, and Inuit peoples. Indigenous women are diagnosed at higher rates with more advanced disease, and they experience worse outcomes. This is not due to biology. It is due to barriers, lack of access to screening resources, geographic isolation, systemic racism in healthcare, poverty, and the enduring impacts of colonial practice. Robust HPV screening must mean more than updating guidelines. It must mean universal access to primary HPV testing across all provinces and territories with clear national standards. Canadians should not receive different levels of cancer care based on their postal code. HPV testing allows for the integration of self-sampling options, and self-collection has been shown to be safe, accurate, and particularly effective at reaching underscreened populations. For many Indigenous women, for newcomers, for Canadians in remote communities, for survivors of sexual trauma, and those living with disabilities, self-sampling can remove a critical barrier to care. It offers privacy, autonomy, and dignity. The moral and economic case is clear. Early detection prevents advanced disease. It reduces the need for extensive surgery, for radiation and chemotherapy in tertiary care centers. It reduces long-term healthcare costs. Most importantly, it saves lives, it preserves families, and it protects communities. Improving HPV screening is not only a clinical decision, it is a reconciliation issue. It is a health equity issue, and it is a matter of justice. Imagine a world where no one dies from cervical cancer because we choose to act boldly today, where a young girl growing up in Winnipeg's North End has the same cancer prevention outcomes as anyone else, where a woman in God's Lake doesn't have to live in Winnipeg for 3 months getting radiation, worrying about who's going to care for her children, where elimination is not just a target on paper, but a lived reality. We have the science, we have the technology, and we have the opportunity. Let this be the Parliament that moved Canada from intention to action, and let us be the generation that eliminates cervix cancer. Thank you. Thank you, Dr. Salvador, for letting me be a part of this important conversation today. I'm Carmen Wyton, the chair and founder of the Women's Health Coalition. The Women's Health Coalition is an advocacy organization, and that's what we need to talk about. How do we make the change that needs to happen that can support women through all of their life stages, ages, and health journeys? Like my colleagues here today, I am confident that we can eliminate cervical cancer in my lifetime. We will need to work with precision and meet women where they are with options that suit their needs. We can work with government, the healthcare system, and community-based organizations to look at innovative solutions. I'm excited to see the increasing access to self-sampling and more use of mobile health units, specifically for women's health. We need to think beyond cost efficiencies and serving the masses. We can introduce approaches to reach equity-deserving populations where women are experiencing higher incident rates, are vaccinated at lower rates, and are not following up for many different reasons. The Women's Health Coalition is catalyzing community-based partnerships across Canada with these targets in mind. With partners, we will launch a women's health van soon. We're hoping that will happen during Women's Health Week. And as Dr. Salvador has indicated, Bill S-243 offers us an anchor to consider enabling preventative health and primary care for all women. We can prevent cervical cancer, we can avoid preventable death, and we can keep women living well, as I said, through all the ages and stages of their health journey. Thank you.
So thank you all for attending today and for listening to our voice. We'd be delighted to field any questions now if anyone has any. Thank you.
I do. I'm Sarah Ritchie with the Canadian Press. This question for you, I think, Dr. Salvador, can you talk to me about the barrier in getting that vaccine coverage up in this country? We've seen peer countries doing so much better than us on the world stage, and I'm trying to understand what's happening in Canada that's preventing us from getting there.
I think one of the biggest problems around this is the access to primary care physicians, nurses, and that primary initial contact with the healthcare system. We have lost a lot of that. People used to commonly go to their physician to discuss various things, and it would be these groups that would talk and promote vaccination. And so when you don't have that constant education that's going on around how important it is to vaccinate for various things, you lose that, and you lose that educational goal that used to happen quite frequently. And so we have to keep in mind that the people who are making decisions about vaccination right now are the parents of the children who are currently attending school. So if you constantly don't keep that educational level up as to the importance of this, we lose that. It gets lost in the milieu of social media and other things that perhaps don't quite support what vaccinations can do.
I think this vaccine in particular, though, has been the subject of ongoing misinformation for years now. Can you talk to me about the way that affects the conversations that people do have, particularly at the school level, with you know, those parents are making decisions about their kids' health in school, and there's been an ongoing conversation, I think, for years saying that this vaccine may not be safe, may not be healthy. What are we missing in that conversation?
I know, because when you look back to when the vaccine was initially introduced, we actually had an incredible uptake. The uptake was well over 80% in all of Canada. There was great enthusiasm for this because not only does it protect against cervix cancer, but it's for boys and girls to protect against cervix, vulvar, anal, throat. It protects against a milieu of cancers caused by the HPV virus through someone's lifetime. And so when people initially were getting it, and there was some, which has now since debunked fears around what the vaccine could do. It's pretty much a sore arm. That is the only thing that has come out of the final studies. And there's a multitude of studies around the HPV vaccination showing how incredibly safe it is. And as to the age, as to why are we giving it in grade school, there's two very strong reasons. One is that a child's immune system is incredibly robust. So when we give children immune vaccines at these ages, they develop a lifetime of protection. Also, we do have to give the vaccine before there is the first sexual debut, because this is a sexually transmitted infection with the HPV virus. And so we're targeting an age and a group that they have not been exposed to the HPV virus yet.
A patchwork across the country, as you know, of coverage for this vaccine outside of school. It's completely different. I'll give the example. I live in Quebec, which accidentally overbought the vaccine and was giving it away for free for a little bit, and then when it runs out, it'll stop. I think I'm trying to understand what the federal government needs to do, because it is not necessarily their jurisdiction, and there is this patchwork, what the federal government needs to do to encourage this to change.
Yes. Is there someone? Yeah, because I know you're part of a once eligible. Yeah.
Yeah. So you're absolutely right that provincial jurisdiction varies. And I think honestly that a lot of the issue is policy based rather than education based. There's a lot of barriers kind of even within individual provinces about why people choose to vaccinate or not. But the two policies in my mind that are outstanding is the approach. So the once eligible, always eligible. I work in Manitoba, and we have a policy like this so that if a child misses out on it in grade school, that they are eligible as long as they meet that birth cohort for the rest of their lives. We also have one of the only provinces with an extended vaccine criteria where people who are at risk, such as those living with HIV, history of sexual assault, anything that puts them at higher risk for HPV infection can access vaccine for free as well. That's one of the issues. The other one is the approach to vaccination in school. And even in Manitoba, we have what's called an opt-in policy where parents have to fill out a permission slip in order for their kid to get vaccinated. And again, there's a myriad of barriers to that. If you contrast rates with Newfoundland, who has an opt-out policy where unless you sign the permission slip, your kid gets vaccinated, their rates are about 92, 93%, whereas in Manitoba, we're not much better than the national average, despite having this extended criteria. And so that's one of the things. When we look at kind of NACI, which is our National Vaccine Advisory Committee, they are now making a recommendation for one single dose for school-aged children. And so that is going to help because one is better than none. I think we have lots of evidence that one is going to improve outcomes better than none, and it's easier to get that one in there. What I would really like to see, though, is that in provinces that are still doing 2 and 3 vaccine strategies, that money is put into more broad vaccination rather than just back into the pot for everybody else to take from. And that's one of the barriers that we've been facing as well, is that money should be dedicated to HPV vaccination, but just spread out through the province more broadly.
Carmen, this question is for you. I'm hoping you can talk to me about the bill that's before the Senate and how this, because, you know, strategy and frameworks are one thing, but how does this actually concretely tie into what you guys are talking about here today? What do you want to see the federal government actually take on?
Through Bill S-243 and a framework for women's health, with one of the principles being around primary care and preventative health, what we can do is work through collaboration around communities of practice. We can, and it would be enabled by federal health transfer funding, opportunities for introduction of new programs that could be available through new funding, and all of that can be anchored by Bill S-243. But one of the things, the reason that there needs to be some very significant collaboration around this, it's not just about having access to self-sampling. It's not also just about getting vaccinated. It's about the full continuum, the opt-in versus opt-out, the behaviors and attitudes about vaccination and vaccination phobia. And so I think that federally, they certainly can raise awareness. They can create communities of practice. They can promote best practices. All of these things are embedded in Bill S-243. And when we're talking about a common goal around preventing cervical cancer and hitting those World Health Organization targets, again, the federal government can play a role in benchmarking every province, holding them accountable to hitting those targets, and where they're not hitting those targets, encouraging them to change their practices. They can increase the scope of practice for healthcare providers so that the healthcare providers allied that are currently working in those remote communities and with Indigenous communities and are the interface with newcomers, they need to be able to have the permissions to counsel those patients, to give them the swabs for screening, to encourage them to get vaccinated. So again, we have a lot of our healthcare system right now that is hamstrung because it runs through general practitioners. And so through Bill S-243, we're really talking about a multidisciplinary approach to all areas of women's health through all their ages and stages and journeys. And cervical cancer fits in because one of the biggest issues is early detection. And so if it's not caught early, wherever that woman is, then there's a chance that she will present with advanced disease that could have been avoided.
Last thing I wanted to ask you, Carmen, this comes at a time, and the timing I think is kind of interesting. The federal government's just announced a strategy on men's and boys' health. You're pushing for a framework on women's health. I'm wondering what this says to you about the state of the healthcare system.
Canada's healthcare system is in crisis, and you could look at it through any micro lens anywhere across the country or as a whole unit. And so there are great conversations going on right now about men's health and the Connected Canadians Health Bill, and though all of them are important. Bill S-243 specifically is focusing on women's health because we are lagging. We are 64 out of 65 developed countries in terms of our commitment to serving women's health. So we have to make up that space. So that's why we're focusing on women's health. We had a women's health strategy in 1999, and nothing has happened with it since then. And so technology has changed. Women work differently today than they did in 1999. And of course, the therapies and options and the healthcare providers that can support them have evolved exponentially in that time. And so I applaud everybody who is thinking innovatively and bringing communities together to address Canada's current health challenges. And I am really excited that over 200 advocates have joined together here in Ottawa this week to take Bill S-243 and the principles that are broad and enabling and turn them into stories that are based on real-world evidence, lived experiences that represent what Canadian women are living with and how they are experiencing our health system.
Thank you. This concludes the press conference. Merci. C'est ce qui conclut cette conférence de presse.
Sorry, I missed that.
That's great.
Great. Thank you.
All right. Thank you.
Thank you, everyone. I think it's a vaccination thing. Thank you.